Rainier Avenue Radio. The Urban League of Metropolitan Seattle, empowering communities and changing lives. The Urban League has been there to serve when our community is at its lowest. It's never mattered what the crisis was. The systemic oppression remains constant for those most vulnerable. Here at the Urban League of Metropolitan Seattle, we'll be temporarily adjusting our hours of operation and available services. If you are in need of resources, we recommend that you give us a call at 206-461-3792. To make an appointment, press 0 and speak with the receptionist. Walk-in hours will be from 10 a.m. to 3 p.m. Monday through Friday. And hey, we'll gladly work with you via phone as best as we can if you're exhibiting any signs of illness to assist you with information to save your home, find you a place to sleep, or connect you to job opportunities. The Urban League of Metropolitan Seattle. That's 206-461-3792.
What's on your heart? Are you exhausted at the lack of progress for people of color in business, politics, and life? This is Cindy Bright, the host of Heartbeat Radio. Each week, we explore this heart condition of the country that is affecting you and me. We have real conversations about what's necessary for change. It's time to change this dialogue. Will you join this Heartbeat weekly, Wednesdays at 7 p.m. on Rainier Avenue Radio?
If you or a family member are 55 or over and need nursing home level care, but want to keep living where you are, check out Providence Elder Place PACE. This program offers healthcare, housing, transportation, and recreational activities. There are no co-pays or deductibles, and it's covered through Medicare and Medicaid. Providence Elder Place PACE works to keep you healthy and in your home. Call 206-320-5325 or visit providence.org Elder Place. Providence.org Elder Place.
This is Paul Pearson, host of Star Time. And when I'm not stopping a Mercer Island street brawl, I'm listening to Rainier Avenue Radio.world.
Been around for a long, long
What's going on, Rainier Avenue Radio? You are tuned in to a press briefing with Public Health Seattle and King County Dr. Jeff Duchin, who will be here to answer your questions on the mask lifting, continued vaccination efforts, and where we are at COVID-19 in general. We are waiting on the doctor to start his session, so until he does, stay right here on Facebook, YouTube, Twitch, the Rainier Avenue Radio app, and the Rainier Avenue Radio website. And we'll bring it to you when he starts the session right here on your community radio station, Rainier Avenue Radio. And if you got questions for the doctor, email them to us, rainieravenue.world@gmail.com, rainieravenue.world@gmail.com. See you soon.
It's crazy today, people.
Looks like we've got Rainier Avenue Radio. I'm guessing it's Tony B. Hi, Tony. We're going to wait just a moment to see how many other folks we get to join. So we'll just hang out here for a couple minutes longer. All right, well, I'm not seeing other folks joining, which is understandable given the heat and everything else that's going on. So, Tony, this may be sort of a private briefing for you and your viewers, though we'll also be recording this and sending this to other media outlets. And so hopefully this can be useful for them as well. And my name is Kate Cole, and Christina Braddock, who I know you've been working with, put a lot of work into organizing this, but she is on a much deserved vacation day today. So I will toss it over to our health officer, Dr. Duchin, and we'll hear a few remarks from him, and then can take questions from you, Tony, and anyone else who happens to join us. Dr. Duchin, to you.
Thanks, Kate, and welcome, Tony, and anyone else who's joined at this time. Given the heat, I commend you for your resolve. I hope it's cooler where you are than it is where I am. I'm going to start with a few words about the heat and then talk a little about COVID, and then welcome your questions. And this record-shattering extreme heat is really just the latest example of our climate crisis that's impacting human health right here, right now. Extreme heat is the leading cause of weather-related deaths in the US, and climate change is causing increasing frequency and intensity of heat waves and other extreme weather events. The health and economic consequences of climate change are only projected to worsen, and for this reason, climate change is undoubtedly and widely recognized as a health emergency, and reducing greenhouse gas emissions are literally a matter of life and death. I'm sure it won't surprise you that there is a large overlap between neighborhoods and communities of color that are at highest risk for heat-related and other climate-related health effects and those hardest hit by COVID-19. The impacts of climate change on health are significantly related to individual and community vulnerability and resilience, in particular to pre-existing health status and living conditions. And in the US, we know that these factors differ by place, race, and income as a result of inequities in the distribution of money and power, historical disinvestment in some communities, discriminatory practices and policies over time, structural racism, higher pollution burdens, and lesser access to resources for health. And therefore, low-income communities and communities of color are disproportionately affected by the health impacts of climate change. Now, with respect to where we're at with our COVID outbreak, things are looking increasingly better each week, which is a tremendous relief. And this is largely due to those of us who have been vaccinated. New cases and hospitalizations have been decreasing progressively. Over the last 7 days, we've had 66 new cases reported each day, which is down 84% from our peak in late April. COVID-19 cases are at the lowest level since June of 2020. And last year at this time, we were beginning to see the first hints of the summer surge that was related to people gathering when vaccines were not yet available. I don't anticipate we'll be seeing a large summer surge this summer, but I do think that to the extent that people who are unvaccinated get together, particularly indoors, without masks and without distancing, COVID will continue to spread, and more rapidly than ever in those settings for those people. Now, we are continuing to see improvements in the number who are vaccinated. 95% of our recent COVID cases, our hospitalizations and deaths are in people who are not fully vaccinated. And it's great that 72% of King County residents aged 16 and older have completed their vaccine series, and almost 80% have started it. All race and ethnic groups have 70% or more completing the series for people aged 15 and older, and 80% or more completed for those 65 and older. And this success is due to a remarkable set of collaborations between our amazing community partners, our healthcare providers, our public health team, and the good sense of the people of King County who are coming forward to get vaccinated. Our goal is to continue to bring cases down through vaccination across all communities, regardless of where they live in the county or regardless of their racial or ethnic background. Because of the gaps, however, currently, particularly in our Black and Hispanic communities, we are seeing a slower decline in cases in communities of color compared to the county as a whole. But we will be striving to reach a minimum of 70% fully vaccinated for all race and ethnic groups and in all zip codes, and ultimately even more people who are eligible vaccinated. Our current rates for those 16 and older for American Indian and Alaska Natives is 79%. For Asian Americans, 82%. Yet for Black and African American residents, 54%, and for our Hispanic and Latino residents, 56%. Native Hawaiian and Pacific Islander community members are vaccinated at 79%, and white residents at 68%. And our BIPOC-led community organizations and community clinics and businesses have been key to our vaccination strategy by sharing vaccine safety information, by making sure people have their concerns addressed, providing vaccinations in trusted environments. And we're very grateful to all of our partners and all of these organizations and community members who have been essential in this vaccination effort. Tomorrow, for example, there'll be an event, weather permitting, at Washington Hall in Seattle Central District from 3 to 7 p.m. No appointment needed. Vaccines are free. Now, let me say just a few words about our reopening and the new environment that we'll be in. On June 30th, the state of Washington will be lifting current restrictions, because the current levels of COVID-19 have decreased substantially. This is in large effect due to vaccination. And over 75% of Washingtonians over 65 years of age have received the vaccine, protecting them from severe illness. There will no longer be mandated restrictions on the number of people who can be in most indoor spaces or how far they must be spaced, with the exception of large indoor events with more than 10,000 people. Also this week, our local King County mask directive will end on June 29th. After that time, masks will still be required for people who are not fully vaccinated in indoor locations that are public. And even vaccinated people may choose to continue wearing masks in public spaces if they're at increased risk for severe infection or have an underlying health condition, or if they're in close contact with someone at increased risk, or if they just want to support mask wearing by unvaccinated people, or because they feel more comfortable wearing masks after so long, or they value its benefit in preventing other respiratory illnesses or against allergies. So where we are today, which is a much better place than we've been at any time since the pandemic started, thanks to our stunningly effective vaccines, tremendous safety record, and to everyone that's come forward to be vaccinated. And that's how we're going to get back to a long-term healthier lives and long-term healthy economy. But because so many still are not vaccinated, and because this is a new emerging pathogen for which we cannot precisely predict what's in store for us, it's important to remember COVID isn't over. The virus has been suppressed, but it's not eliminated. And those viruses that are spreading are more contagious and need to be taken very seriously. Going forward, as we switch from government-ordered population-level mandates, each of us will need to understand and be comfortable with the level of risk we're willing to take as individuals and for our families. Most vaccinated people will be at very low risk, but there are people who could not be vaccinated yet or remain at risk for other reasons, and it will be important to understand what's going on both in your community and your personal health so that you can take the steps to protect yourself and the people around you. So as we try and get back now to activities that we've missed and consider our own risk tolerance as much as possible, here's my advice. Get vaccinated. Get vaccinated and get vaccinated. If you're eligible, and also encourage others to be vaccinated. The more people are vaccinated, each community is better protected. Don't always have a mask with you. Don't throw away your mask, and make sure it's at the best quality and the best fit possible. Again, anyone who's unvaccinated should continue to wear their mask in indoor public places. Any business or organization can continue to require masks for their customers or visitors to protect them and to protect the workers. We really must all understand the importance of improving indoor ventilation, filtration, indoor air quality, because this is an airborne virus and is spreading even better than previously because of the new variants. We know how easily this virus can spread in crowded spaces. Indoor crowded spaces for unvaccinated people continue to represent a significant risk, and physical distancing and masks are very important in these settings for unvaccinated. So businesses and any organization with indoor facilities need to take steps to improve indoor air ventilation and filtration. And this will also be incredibly important as we transition into fall and winter, when the virus is expected to transmit even more readily, and we would expect to see surges among people who are unvaccinated. Finally, outdoors is better than indoors. As always, COVID-19 spreads much more easily indoors. So if you're planning or attending large gatherings that will include unvaccinated people, the risks are much lower outdoors. And finally, continue to get tested and isolate or quarantine if you've been exposed, if you've been around someone who's had COVID-19 or you have symptoms. COVID is still out there, although the risk is much lower than it's ever been, and the new variants are even more contagious. So with that, I am happy to have a discussion as long as we can all withstand the heat.
Great, thanks so much. We'll open it up to Rainier Avenue Radio to see if you or any of your listeners have passed along questions. Rainier Avenue Radio may just be recording and live broadcasting, but not have questions to ask. So I think with that, we will wrap it up. Dr. Duchin, any final comments you want to close with?
But very efficient today. This is a very unusual time where we're faced with two public health emergencies simultaneously. A global climate emergency that is causing a deadly heat wave throughout much of the country currently, and a deadly COVID-19 pandemic that is thankfully has a cure, in that it is now a vaccine preventable disease through vaccination. I wish we had a vaccine that I could offer you to protect us from the global impacts of climate change, but we don't. It's going to require significant effort from all of us, and I encourage everyone to understand the steps that we can all take as individuals to address the long-term impacts of climate change and make sure we avoid the most catastrophic impacts that will occur if we don't change our ways very quickly, and also to understand what you need to do now to adapt to these types of events, which inevitably will occur based on the heat that's already in our global environment from past years of carbon emissions, greenhouse gas emissions. With respect to COVID-19, please continue to be vaccinated if you're eligible. That's the way you, your family, and your community will get back to your pre-COVID life and ways in our pre-COVID economy as quickly as possible. And finally, just remember that for those that can't be vaccinated, precautions are still recommended, particularly around the upcoming holidays when people will be gathering. Do so outdoors if there will be unvaccinated people, and if there will be indoor gatherings with unvaccinated, mask and distancing and good ventilation will be very helpful in reducing the risk for everyone. With that, I hope we're through this heat wave as quickly as possible with as few illnesses and deaths as possible, and I look forward to talking to you soon.
Great. Thank you so much, Dr. Duchin. Take care.